Hi, it's Steve Major, MD Yogi. Hoping you're doing well. Wanted to talk to you today about the COVID-19 and coronavirus crisis that we're involved in terms of the pandemic, and hopefully give you some advice on how to cope with this in a way that you're going to manage in a way that's more healthy. So in that mind, just before we start, we're going to just breathe, because I think the most important thing is just to take a few breaths and actually look at this calmly, without any panic, without any need to let fear overcome us. So I just close my eyes. I'm going to just take 3 breaths, and this is just to tell our bodies, tell our mind, and everything is okay. So just take a deep breath in and breathe out. Take a deep breath in and breathe out. Deep breath in and breathe out. It's important when we are stressed that sometimes we need to do that. Just take a few deep breaths, close your eyes and pause, and that can give us the ability then to cope with any stress in our life, whether it's stress with family, it's at work, just stress in general. Now, specific to the coronavirus or the COVID-19 virus, there's a lot of things that I want to talk about, but particularly I want you to understand that things are going to be okay, that we're going to all work together to make sure that everybody is taken care of in the best way possible, but also to understand that if all of us work together and all of us do our best as human beings to care for each other and be compassionate to each other in many ways, we can make sure that we get through this pandemic in a way that's helpful for all of us. So it's helpful to understand that the decisions and actions you take can make a difference to the ones that you care about in your life, your loved ones. And I think that's really the reason I want to talk about the coronavirus and COVID-19. There's a lot of technical information coming out daily, so I'm not going to speak to the specifics of how it's transmitted, how you wash your hands, and those things that we all understand. I think it's coming to understand some of the issues around social distancing and how we can use social distancing and those changes to actually make sure that the loved ones that we have in our life are taken care of. As many of my patients know, my mother passed away, unfortunately, last December after a long battle with Parkinson's. And as with anybody, losing your mother is quite a difficult time. And my father, thankfully, is still alive at 84. So being in that high risk group of patients who could who could die from COVID-19, I don't want to be the one as a physician to bring that virus to him and infect him and potentially cause his death. And I think it's understanding, how do my actions in the world make a difference to the ones that I love, and I want my father to be around for a lot longer. So I wanted to talk about how we each can make decisions on a daily basis that can change that. I think it's also important to understand that this epidemic or pandemic is going to be around for a little while. I think there's going to be significant disruptions to our lives, not only your life, but even in my practice and how I work in my office, and potential that we're going to be shifting to virtual care for patients, where I'll be phoning or teleconferencing with patients much more. All sorts of different things that'll change for all of us in terms of our daily routine that are very important. With that in mind, it's important that we don't do things that are potentially hurtful to others, and some of the things we see online where people are hoarding, whether it's food or hand sanitizer. Those may be helpful for those individuals, but then if someone who needs hand sanitizer doesn't have it, and then they're going to visit and then visit other people and transmit the coronavirus, we've done a disservice. So I think it's important that we buy what we need, but we don't get into the fear response where we start hoarding things. In terms of our contact with others, I think if you have contact with seniors or those who have any significant medical illnesses on a regular basis, that you need to re-examine when you should be having contact with those people, and is there a way that you can contact them differently? Is there a way you can contact them virtually? How do I ensure as a human being that I'm not the person that is, going to get COVID-19 and be okay and not be sick with it, but then infect somebody who then gets sick and dies from it? Not to put blame on people for that, but to understand that we all have a responsibility to each other to take care of each other, and how do we each as human beings make sure we make decisions that are beneficial to those around us. So in terms of the social distancing, I think we need to examine how often do we go to the store? Do we need to be going to the store to purchase items that are not necessary at this time? Do we need to be going to visit a loved one if we're starting to feel sick with a head cold or a respiratory infection that could potentially be a milder form of the coronavirus? And it's important then in that case, we know that the death rate when it gets into a nursing home or a long-term care facility is one of the highest death rates. We see that when we've looked at instances where it has happened in different countries. So we want to protect our seniors. We want to protect those that we love by ensuring that we can't be the vector. We can't be the one that actually infects other people. So I think we all have an opportunity here to make a change the way we live our lives, to make sure that we all get through this, and that we make sure that the healthcare system can deal with those that are ill. It's really important as well that you keep telling yourself that whatever happens, that you're going to, survive, or you're going to deal with it. In life, we always fear when things could happen to us or what could happen to us. And instead of getting into a fear response, we should be working more on preparedness. How do we prevent? How do we make sure that we're healthy? How do we take care of ourselves in a way that if we're unfortunate enough to get this infection, how do we make sure that we protect others around us who are close to us, and that we take care of ourselves as well? So I think it's important from this point of view. How do you then cope when you're stressed with this? How do you take some time? Some of it may be disconnecting from the media, because there's so much media coverage for the coronavirus and COVID-19, and that can increase your anxiety. So understanding what you need to do in your day-to-day routine and how that changes with this, but then saying I'm going to disconnect from some of that information for a time to understand and decompress, because we all know that we're all mortal. We all know that at some point in time we're all going to die, but we don't need to do or act in decisions or make decisions that will shorten that. And I think there's risk in everything we do. We get into a car every day, or for those of us who travel and don't think about a risk, but there's a risk of dying from car accidents. There's a risk of dying at your home just from slipping and falling. There's risk in life. It's how do we control those risks in a way that is responsible not only to ourselves but to the ones that we love. And so I just wanted to express those thoughts and try to understand that, get you to understand that this is going to be around for a little while. This is not going away tomorrow or 2 weeks from now or 4 weeks from now. I think we're into a situation where there's going to change in the way we all are interacting with each other. I'm a physician and friend who often will hug my friends or hug my family and some of my patients, and I have to change that behavior. That behavior, which has been entrenched, can't continue, because I don't want to put my patients and friends and family at risk with that. So that social distancing of a meter away is really important. And I think if we change those behaviors now, before the virus actually comes to our community, then we're actually being proactive in a way that we slow the spread of this illness, which is potentially quite devastating to the ones that we care about and the ones that we love. So in that context, you need to then look at how you change your behaviors. And we don't shake hands anymore. Whether you give an elbow a bump or you give a foot foot bump, but understanding that there's ways that we can express our connection to others and still be connected without that physical touch, but ensure that we still stay socially connected, whether it's through virtual ways that are quite available with technology nowadays. So I encourage you to understand that there's going to be significant disruption. There's going to be opportunity for us to lean on each other in a different way, that we can rely on each other. I know from working in the healthcare system that in the hospital and doing emergency shifts, that the staff are phenomenal. I do not have any hesitation in saying that, from the clerical staff to the cleaning staff, the labs, the lab workers, the respiratory therapists, nurses, PCAs, all the healthcare staff, physicians included, that and the ones I'm not mentioning because there's so many different healthcare workers, that they work together as a team. It's essential that we understand that those people are putting themselves at risk by working. The cleaners who go in to clean after a COVID patient is there are taking a risk by being exposed, even with wearing protective equipment, but they're still doing that. So I really have faith in humanity and faith in the healthcare workers that I work with on a day-to-day basis, that we're going to get through this. It's how we as a society and all the individuals in our society make some changes, and some of those changes will include sacrifice. There will be financial hardship for some. There will be patients or people who suffer because of food insecurity. How do we make sure we take care of those that have limited access to food supplies? How do we help those most in need? How do we each reach out in the community in a way that we take care of each other? And if we put that support to each other, I think we can get through this, and we can get through any challenge that we face in our communities. So I know I always say at the end of my videos, you've got this. I believe in you, and that you can make a difference by changing your behaviors and the behaviors as recommended by our public health agencies, our provincial public system, and those who are quite articulate in giving the advice that we need. And prepare for disruption, and that disruption could be significant beyond school closures. It may be restrictions in our travel, maybe restrictions in our ability to go outside, but we need to accept some of these restrictions to ensure that we deal with this in a way that we are able to get through this pandemic in the best way possible. And I think it's important. I normally will end my video by doing a dance. I think today, I just end with a little meditation, just a little breathing exercise. When we take time to meditate or breathe, we just tell our bodies, our mind, and our soul that everything's going to be okay. And I think when we're stressed with all this information coming in this pandemic, I think we need to take that time, even if it's a couple of minutes, just to breathe and be present. So with that in mind, and just if you can and you have a couple of minutes, just close your eyes and just find a comfortable, long, erect spine, and you just find some comfort here. And you're just going to let your breath come naturally. There's no need to control your breath, and just observe your breath coming in and out. There's no need to control the breath. Our body will breathe for us naturally without any control. And as we observe our breath entering our body and leaving our body, just focus on how we're feeling. Connect with yourself. And as you're observing your breath, you're going to start thinking. You're thinking about what I've said, thinking about the coronavirus, and then just come back to your breath. Just say, everything's going to be okay. I'm just going to observe my breath for a minute. Breathing in and breathing out. And again, letting your breath just come naturally, and as observe whatever way it's coming into your body and leaving your body. And if you've started to think, come back to just observing your breath coming in and out naturally. No need to control, but just focus on that breath coming in and out of our bodies. And slowly and gently open your eyes. As we breathe, and we breathe calmly and observe our breath in a meditation, we're telling ourselves that everything's going to be okay. And I can tell you that if you take the time to take care of yourself, if you take the time to prepare for whatever could happen in life, whether it's this COVID-19 or coronavirus or any other potential events in your life, just remember that whatever happens, you're able to overcome it. And the challenges that we deal with help us to understand the importance of enjoying today and getting the most out of each day. And as I say in all my videos, I believe in you and you've got this. Namaste.